parents come to me and say, "Doc, we had a baby with heart problem. The baby did not survive. Now we are going in for second pregnancy. What can we do?" And the first thing I tell them is, anything do not put on or in your body which you don't know the 100% ingredients of. And the most common things today are food.
But this should have been there in the restaurants also. Like if they are bringing any food to you, then they should perhaps mention how the food has been prepared. I mean, we are talking about the larger ecosystem and not just a particular health problem.
So larger ecosystem affects the body of the mother, and what is the purest on this planet is a baby who is going to be born. And if we are going to give more diseases to more children before they are born, that is so very sad for me, that this planet is not the right place. So I think, that is why I emphasize in a congenital heart disease discussion that men are not creators, women are. They're endowed with that gift, and that is why the world needs to make sure that they're not exposed to those chemicals at any cost whatsoever.
The future of, pediatric cardiology in one word, how do you see the future, or one sentence probably?
Every child in India should get the treatment they deserve.
When we hear the words heart disease, we almost always think of adults. But every year, thousands of children are born with heart conditions, many of which are treatable if diagnosed on time. The challenge isn't always medicine, sometimes it is awareness, access, timing, and the healthcare system itself. Today, we are pulling back the curtain on a world most of us know very little about. Welcome to another episode of the Healthy Podcast. I am your host, Hemanshi Tewari, and joining me today is one of India's leading pediatric cardiologists, Dr. Vikas Kohli, Director, National Child Heart Institute. Dr. Kohli, thank you so much for being a part of this episode. And I would really want to start on the fact that, when I was actually preparing for this podcast a night before, I realized something very interesting. Like whenever we talk about heart disease, it really, like we immediately think of an adult person, like a 50, 60, and now it is reduced to 40 and even 30 years of age, but never of an unborn baby or a baby who has been born a few hours ago or who is a few days old could also be perhaps fighting a heart condition. So let's just start with that. I mean, how often do you find yourself having to change that perception before actually talking about the treatment to their parents? I mean, do parents really believe that their child who is not even born yet can have a heart condition?
So let's talk about yesterday. I had a doctor come to me, to my office, and she had a report, and she is a medical doctor working in a medical college, and questioned me, "Doc, this is a report. They are saying my child has a heart problem. Is it even possible?" And there you go. This is a medical person who's unaware that children can have heart disease and it can be diagnosed before the baby is born. Give you another example. I was sitting with the CEO of a healthcare company, and I told him what I do. And he couldn't believe that there is a field which is totally dedicated to heart disease of children. And I had to tell him the facts. It is the most common birth defect. Happens in 1 out of 100 babies. There are 3 lakh approximately born every year, a significantly more number than majority of the diseases which have a national program for themselves. And 30% of these babies are not going to see their first birthday unless they undergo surgery in the first year of life, which majority of them are not undergoing a surgery in the first year of life. So they contribute significantly to the infant mortality rate and the neonatal mortality rate. And if we have to get to a developed country and get our infant mortality to single digit, it's not happening without taking care of this.
Absolutely. And I think we do not have as much courses also, as much need courses in the institutions as well. I think last year, Ram Manohar Lohia Hospital or Apollo Hospital, they had this pediatric heart cardiology, something like that, a course, but not many institutions.
So nationwide, there are about 20 centers which are offering a course for specialization in pediatric cardiology, which is certified by the Diplomate National Board, DNB. And this course qualifies about 22 to 25 people each year. There are about 200 professionals in the country today, and adding only 25 per year, The number of districts in the country is above 600. We don't have one doctor per district also. So yes, US has about 10,000 doctors in this field for a population which is one third or one fourth of ours, and we have less than 1,000 people taking care to diagnose this condition in our country. So massively manpower deficient field and severe shortage of number of institutions where such training can happen.
Yeah, absolutely. I mean, very rightly said, the numbers are huge to make of it that how much of a big problem it is in India today, and we do not have as many professionals to handle these many problems. But are we talking about, I mean, of all the babies born with, I think, congenital heart disease is the word, how many of them actually make it to the right specialist at the right time? Because you just said for a lot of babies, you have to perform surgery within 1 year.
30%, yes.
Right. So, how many of them actually make it to the right specialist?
So I think less than 10% of them make it to the right specialist, and less than 10% are getting treated as of now. So this is a severe shortage of or deficiency in the diagnosis and treatment. For example, the International Body on Pediatrics recommended that every child born in a hospital anywhere in the world needs to have a pulse oximeter, and we all are familiar with pulse oximeter, oxygen level check in upper limb and lower limb of the baby before being discharged from the hospital to be able to suspect critical heart disease in a newborn. This is universal recommendation which Indian Academy of Pediatrics also accepted, but this is not implemented in our country yet. And who is responsible? To a large extent, us doctors are responsible also, but that is the starting point. And when I say this, I'm not addressing and bringing, agony to the community by saying, hey, we haven't done this and we are such a country. I'm actually addressing the government that you need in this field a domain specialist who has a roadmap of how to solve the problem for the country. This is a number which is fixed every year. These many children are going to be born. This is geographical distribution. It's related to birth rate. And these are the number of treatment centers we need, each with the capacity of this. It's as mathematical as that. This is a solvable problem. This is not like COVID, which is going to multiply the number of people they meet, it's going to multiply. No. This is not like cancer. We don't know how many more we could diagnose next year. So there is a mathematical solution to it in an algorithmic fashion, and we need to address it at a starting point and reach the culmination, say, in a 5-year period.
If you are given this opportunity to address the gap that India currently has, because obviously the department knows that there is a gap, like you said, the Indian Pediatrics Department. There are not a lot of policies implemented, they are not executed on ground. So if you had to do it starting today, what will be the first thing that you will sort of change?
So that's a very good question, and I live with this question ever since I finished my education and came back voluntarily to India. I had an option of living abroad and working abroad, but I know I would have not made it to be a happy man at the end of my life. So I decided to come back, and since that day I always think, and I meet poor people every day who have children with heart disease. The solutions have to be initiated. The actual instruments are already existing. Let us say that. Nothing new has to be invented. No new organization has to be invented. Government has built the initial systems. They exist and they are functional. We need to implement and complement and bring them together. And once that is done, the results will very rapidly start showing up. Yes, it has to start at the Asha, Anganwadi workers. They have to be given a video which says, this is how you recognize a child who's not breathing well or not feeding. Take him straight to a tertiary care center, not to a primary care center. That grassroots level, that's where 74% of India still lives. Or recent statistics, 70% of India still lives. Urban India has access to everything if you have the money, or to government hospitals which are close by. Then we need capacity building. There is the RBSK program of the Government of India, which is actually a lively program which is functional till a certain point. And that point is recognition of heart disease. So wherever RBSK is working, Rashtriya Bal Sevak Karyakram, so wherever that is working in whichever state, because it's a state agenda, funding for which majority of it comes from the center and state adds to it and implements it, then wherever it is working, they are able to recognize. But translating the recognition into treatment has remained a major challenge because number of institutions are small. So that cannot happen overnight. Also, there is a very big discrepancy, as in every field of healthcare in India, that private hospitals are always looking for more patients and have empty beds to some extent. Government hospitals are overloaded with patients. There is a mindset of the government hospital doctor that I cannot write, please refer to so and so hospital, while government has implemented that if a patient reaches a private hospital in emergency, they have to treat free of cost. That is not being utilized. In addition to this, there is a great tool called Ayushman, which is available, 5 lakhs to a family. Which private hospital can't treat heart disease in 5 lakhs? The government wants, in one single sentence, can put a cap that you will not charge more than 3.5 lakhs for heart surgery, which is what heart surgery costs. And that's it. It'll start happening tomorrow. So every single level, from recognition, screening, antenatal screening, district level, organization of RBSK programs, implementing and connecting to private institutions or government institutions, available capacity, waiting lists, etc. It can today be solved using softwares, IT, technology, and building the whole network. Within days and weeks, it can be solved. It is like the alphabets and the words are there, we just have to complete the sentence. It is not a huge rocket science. It is a no-brainer for the person who can see it day and night that everything exists.
Yeah, but why do you think that if it is so easy to solve this puzzle, it has still not been solved yet?
I don't blame the government. I don't blame the government. I can be unhappy and keep blaming the government. But once I sat with a government official and I asked, and I said something of that, he said, what is the government? Think, answer this to me. What is the government? We are the government. So I actually suggest that the government recognize a group of people who take care of this. They have built the instruments. We need to bring them together and solve the problem. So government has its plate full to the brim with so many international agendas, financial agendas, day-to-day fires which are burning new ones. This is not going to come up on their plate as number one tomorrow morning. I can guarantee you that.
Yeah, but why healthcare shouldn't come to their plate, like shouldn't be their number one priority?
Okay, so let's go back historically. I am again not going to be tempted into blaming somebody else because I don't look at pointing a finger as a solution. I think I need to be the solution and part of the solution. This is my 24/7 thought process about how to solve this problem for children in India. So look at states where this was implemented, when healthcare was given as free or funded to the children of that state, that government never lost an election, consecutively never lost an election, unless they made very big blunders. So the language a politician wants to hear is in terms of votes. I'll give it to them. I'll stand with them and say, you want votes? Give them health care. Give their children health care. They're poor people. 25-year-old man in India has no earning capacity who's living in a village. He's going to be a slave in somebody's farmhouse or farmland. He's going to be sowing paddy and reaping paddy or wheat. That's all he's going to do. Where does he have money, 3 lakhs, 4 lakhs to go to a private hospital and get treatment? Where will he get the Ayushman approval, which will be accepted by a private hospital? Doesn't accept Ayushman. So who's going to bring the Ayushman to a private hospital, fix the pricing in a private hospital? We have to make sure that the government ensures that we have to make the government bring it to their agenda number one when the fire of the day is taken care of.
But do you find government professionals or families of the government people coming to you for the checkup of their child as well?
So I'm available to a huge spectrum of the society, to be very factual. And this was a thought process I went through. My education never told me that you will exclusively treat who can pay for you. So why should I only treat people who can pay for me? And why did and when did and how did money come into the equation of treating a patient? So that is a philosophical question which I don't necessarily want to get in. But I, in a day, see about 2 to 3 times the number of free patients as compared to private patients. So if I'm seeing private patients, I would see 10 or 15, I would see about 20, 30 free patients. And in that spectrum, yes, I like to see patients from the armed forces, and I tell them, you have the right not to pay to me because I respect armed forces a lot. And I see patients from CRPF, etc., BSF, who are not necessarily privileged to be armed forces, but then they do lack access to great health resources. And yes, whichever government official has access to me and comes to know and needs me, I hope not too many in any sector for that matter, they do come to me and I treat them like every other patient.
All right. On that note, see, we have already spoken about that we do have the budget for it, right?
Yes, we do have the
We
budget.
do have the
I
budget.
totally agree. It is not a budget issue. It is not a new program to be created issue. It is a connection of various programs and few lines of rules which need to be written for the private sector.
Yeah, and it's really about the right and not privilege. Right now, it is only the privileged ones are getting the access to this care. On that note, let's get back to the medicine part of it. What do you think are the most common symptoms that parents, dismiss before, because probably it doesn't seem that serious to them?
No parent will ever reach a point of thinking, oh, this is the problem with my child and this may be a heart problem, out of fear or out of lack of information and knowledge. So majority of the parents who may connect that may have a child who says they have chest pain. But children don't have chest pain from heart problems, unlike adults. So 95% of adult chest pain is heart related. 95% of a child's chest pain is related to gastric symptoms, muscular or something else, but not heart. Majority of the parents would actually go with a complaint to a pediatrician, who's their neighborhood pediatrician who gives them vaccines, and that doctor would suspect a heart problem and would be the first one to tell them that I need you to evaluate your child's heart and go and get it done from a pediatric cardiologist, which is actually the life-changing moment for the parent. So what symptoms should a parent know if they're listening to this podcast? Number one, if your child is, and it's age dependent, if your child is under 1 year of age, not gaining weight in spite of feeding, if your child is under 1 year of age and when feeding sweats, gets tired, stops feeding, that's equivalent to you climbing 2 flights of stairs and getting tired. So that's happening with the baby feeding. That's very serious. If your child's breathing is much faster. Now, let me also qualify, not every patient with these symptoms will have heart problem. Majority of them won't. Few of them would turn out to be heart issues. So we breathe at 12 to 15 times a minute. A child breathes at 40, 45 times a minute. So to a parent, that will appear very fast. But if a child is breathing much more than that, is what I'm referring to. And if a child gets repeated episodes of pneumonia. Now, an infection in the throat or nose is not a pneumonia. X-ray documented pneumonia is what we count as pneumonia. So that is the qualification of symptoms which we would say, yes, please seriously think of your child having. Now, I do get children sometimes where a heart disease has been missed for a decade.
Yeah,
And
I mean, they
that's
are
a
being treated for something else and probably the condition is around heart.
Yes. So most commonly, those children are being labeled as having low immunity, allergies, repeated chest symptoms, given nebulization repeatedly over a long period. And in addition to that, they have not gained weight and are quite unwell. So that is the collection of symptoms whereby, having said that, I must also give you the story of a 75-year-old man with a hole in the heart who came to me for the first time recognized as having a heart disease since birth. So it can masquerade itself for that longer time. And that's a man. I have had women who've been 45, 55, 65. Hole in the heart, went through birth of 2 children. Nobody ever picked it up. And it was that silent. So on one hand, it can be that silent. On the other hand, it may manifest within 1 year like this. And in the extreme form, newborn in the ICU, not maintaining blood pressure, not maintaining oxygen levels, having an abnormal X-ray, first thing you need to rule out in those situations is the heart, because that gets missed or delayed, it can affect the child's life or it can result in other organs not functioning normally, which practically happens every other day in our life. unfortunately.
So, just to summarize what you said, if every parent remembered just 3 warning signs, what would that be?
So, repeated episodes of documented pneumonia, baby not gaining weight, getting tired while feeding. These 3 things I would say very clearly.
Very rightly said, because as parents today, they often worry about the obvious things like cough, like fever, but it sounds like some heart conditions can be much quieter. Like you said, one area you have pioneered is also fetal cardiology. So for many people, that's still an unfamiliar term. So let's start by understanding what is it actually.
That's the future we are living in today, not going to happen tomorrow. So, at 18 to 20 weeks of pregnancy, 80% of congenital heart disease can be diagnosed. The lady I was mentioning to you at 20 weeks got diagnosed with a congenital heart disease in her baby. The advantage of that today is, number one, if it is critical heart disease, which is going to affect the life of a child, the parents carry the choice of not continuing with the pregnancy and having their baby go through the pain of several heart surgeries and not surviving. On the other hand, if it is a non-critical condition which may require one form of treatment, one single step treatment, and they would be cured for life, then they would be aware of that, rather than on a day of celebration that we have a new baby and balloons and so many things happening. Suddenly the doctor comes in and says on the day of birth of the baby that we think your baby has a heart problem, and the parents like, heart? How can heart happen in our baby? Which brings me to the very beginning of your discussion, that it is a surprise and a shock for everybody that a baby can have a heart problem. So science has reached a point where antenatally we can diagnose. But how, which pregnancy to look at is a more important question, I think, because there are innumerable women who are getting pregnant in our country. So which women? This is where the onus comes on the person who's doing the ultrasound. There is no symptom, there is no preceding disease which a mother would have, which would cause heart problem. This is not genetics at play, this is nature at play. So just like, a natural event like earthquake or volcano would happen and be quite unpredictable, this is creation of nature.
So
And
it is not affected by the, of how parents are living their life, not by their lifestyle, like if they are not living a good life or probably there's...
no, this is what I meant by mathematical, that 1 out of 100 is going to have, irrespective of social status, irrespective of their lifestyle, irrespective of majority of the medicines which a mother may be taking accidentally without knowing she's pregnant, will not cause a heart problem in the baby. If I may divert to, the pregnancy itself happening, mother or to be recognizes that she's missed a period and she goes to her gynecologist. Gynecologist says, let's get a urine test, let's get a blood test, and let's get an ultrasound. You get an ultrasound done, the mother gets an ultrasound done, and the doctor says, I hear the heartbeat, you listen to it, I'm increasing the volume. That's when pregnancy gets diagnosed. That's 6 weeks of pregnancy, 42 days. From the day of conception to 42 days, the heart is fully formed. All defects are already defined in those 42 days. They don't happen after 42 days. The heart just magnifies in size after that. Heart is the first organ to form. That's why the heartbeat is looked at 42 days or 6 weeks. And then that circulates the glucose and nutrition which the baby gets from the mother to the stem cells of liver, kidney, brain, lungs, everywhere. And then those organs start forming. So by 42 days, first the circulatory system forms and the pump forms. So a mother is not even aware when the baby's heart is formed that she's pregnant. But science has done enough research of several 100,000 pregnancies. Is there a deficiency in her nutrition, diet, which we can say, yes, this causes heart problem in the babies and we can eradicate this today? And there is none.
All right, so what time, when should an expecting mother consider a, fetal echocardiography?
Here are the clear-cut indications. Any abnormality in ultrasound, which indicates, let's say, common things, cleft lip, cleft palate, kidney issue, or, foot not being normal, lips, fingers not being normal, go straight, rule out heart. These are, on one side, relatively minor. If heart is majorly deformed, since it's the commonest, it's also the most common associated problem with any one of these. So immediately get the heart ruled out. If you have a associated diabetes, then especially insulin-dependent diabetes, not gestational diabetes. Insulin-dependent diabetes, which at the time of conception, the HbA1c was above 7 or 8, high association with birth defects in the baby. If the mother is on certain medications for epilepsy or for psychotropic medicines for mood elevation and depression, those are associated. Very specific medicines, not in general, are associated. There is a very, very specific condition called lupus. If lupus is there in the mother and the mother's specific antibody ROLA are positive, it can cause an electrical problem in the heart in the baby, which will require that baby to have a pacemaker when born. So very specific, very few conditions. Now, one chemical I'd like to mention, and that is retinoic acid. Are you aware of retinoic acid? I'm not. So this is what the problem is. The industry has developed skin whitening creams. Okay. Now you get it. Yeah. So retinoic acid is in the cream and even subcutaneous retinoic acid. Now, most women who are in childbearing age won't be applying retinoic acid to the face, which is used between 15 and 20 years of age. But that retinoic acid is something which can definitely cause an abnormality in the baby, which is why it is still a prescription medicine, and which is why, a doctor is supposed to ask, are you likely to get pregnant? Then don't use this particular cream which has retinoic acid in it. So that's a chemical associated with birth defects, but I think the industry has to work very hard to make women aware that that cannot be used if they are planning to get pregnant or potentially can get pregnant.
All right, so how many days or months gap should be there of using retinoic acid and planning for pregnancy, or she should have used it never?
No, I think at least several months of gap, because you don't know when you will get pregnant in terms of the person. One doesn't get to know. And it's only retrospectively.
I mean, if it is planned.
Yeah,
like
if you're planning, then just get off everything. In fact, a lot of time parents come to me and say, Doc, we had a baby with heart problem. The baby did not survive. Now we are going in for second pregnancy. What can we do? And the first thing I tell them is anything do not put on or in your body which you don't know the 100% ingredients of. And the most common things today are food. So food labels, read them if they have a number and they don't have a chemical in it. Chemical you can search. So a lot of times the coloring agent will have a number, emulsifier will have a number. There is hardly a food item. I have sat with food specialists, manufacturers. I have sat with people who make so-called natural, and I won't go beyond that, food products. They say that the industry qualifies the chemical we make as like natural so that they can call it natural and is still having chemicals in it. Before we started this discussion, I mentioned a sentence to you, and that is, we are what goes inside our body. And today, a very specific part of the world, that is in the cooking and bakery world, has moved totally towards knowing every ingredient of what you cook with, so that people are so conscious of what they put inside their body and the effect of those in terms of cancer, malignancy, mental health, major problem, mental health, etc., that keep that slate completely clean. And I sit with teenagers also, because they come to me and I tell them, if there is one very important tool you need to get above the 99th percentile of your subgroup of people or cohort of people, it is cooking. If microwave is cooking, then you're doomed. If you know cooking, you will survive. You will be free from diseases. So that's where it has reached today, that if you're eating outside, you need to know who's cooking and what he's putting in the food for you. Else, the taste, anyone can make it with chemicals.
Yeah, but this should have been there in the restaurants also. Like if they are bringing any food to you, then they should perhaps mention how the food has been prepared. I mean, we're talking about the larger ecosystem and not just a particular, health problem.
So larger ecosystem affects the body of the mother. And what is the purest on this planet is a baby who is going to be born. And if we are going to give more diseases to more children before they are born, that is so very sad for me, that this planet is not the right place. So I think, that is why I emphasize in a congenital heart disease discussion that, men are not creators, women are. They're endowed with that gift. And that is why the world needs to make sure that they're not exposed to those chemicals at any cost whatsoever. I think that needs to be a global phenomena, not just a phenomena for everybody's got a mother, sister, wife. So why for third person we are different? Why only for our sister, our mother, and our family member?
If it is a part of the larger ecosystem, then probably we do not have to, only focus about our mother, our sister, or our family member, because then it would be perhaps a part of the larger ecosystem in that we live. On that note, coming back to the disease that we are talking about, how do you think an early diagnosis changed the outcome for the baby? I mean,
So there have been many scientific studies which have looked at the question, okay, science has advanced, we can make the diagnosis, but is it making a difference or not? And every scientific study has shown that the outcomes are far superior. So they work in two-pronged way. One is the scientific medical management way, and the other is preparing the parents' way. So let me talk about the scientific. So there are certain conditions where a baby can be delivered anywhere, and then at 1, 2, 4, 6 weeks brought to us, and we will then start the treatment. And some of those heart conditions can be managed like that. There is a small subset of diseases, about 5 to 7% of congenital heart disease, which if not delivered, where the baby is not delivered in a cardiac center, the baby is unlikely to survive. So we are directly talking about a very high mortality of 5 to 7% in our subset of patients and improving their outcome directly. So this is one in a critical subset. Second angle that we look at. Now, the perception of the community is that if I tell somebody that your baby has a heart problem, the parents are going to be depressed and they will consider termination of pregnancy. Okay. Believe it or not, the newer generations have defied always, and every single generation has defied the perception of the past. What I come across is people who are in their 20s and 30s don't come and say, we want to terminate, unless it's so bad that it's going to affect the child's life. They say, what can we do to make the child survive? And in that rare group where I say there isn't nothing much in medicine, they tell me, no doctor, we will come back to you tomorrow. You read again, you research again and see in USA is there something? Can we do something for our baby? We want the baby to survive. So the general perception is heart disease. A younger parent would say, let go. But no, that's not true. They want to, and I say this emphatically, even with parents who have no financial means of treating their baby. Even they would say, doctor, we would like to go ahead. Somehow can we get our child treated? Common perception, which other doctors tell me, that, a poor man will say, I'll get another child. I don't hear that. I don't hear that. Common perception, another myth, which in my personal experience, which has defied, is if it's a girl child, the parents are going to let go. I don't see that. I have come across parents from neighboring states where female feticide and all these numbers are very high. A father and a mother had to leave their parents' house, hide in another house of their friends, get their girl child treated, and they wanted their girl child treated. They stayed away from the family. So I think real life experiences are vastly different from myths and perceptions. And I think even as doctors have to be extremely open-ended in our approach of dynamically learning from our patient, not going with a knee-jerk response every time.
yeah, absolutely. We live in a world where we still get to see these good examples in spite of watching a lot of news. I think it's a blessing to us. On that note, have you ever had to counsel parents before the baby was even born? Do you have any such stories?
Every day we end up diagnosing a congenital heart disease, sometimes major, sometimes minor. But the challenge sometimes is somebody has said, and this is the most difficult which I remember, somebody has said, your child has a heart problem and it is so severe your child is not going to survive. And go and meet Dr. Vikas Kohli, he will diagnose, he will counsel you for it. They come to me, and as always, I don't look at reports, I do my own diagnosis, and I sit and I counsel them. And it turns out to be, it is not severe and it's not going to result in that bad an outcome, or may even not require treatment. And I have several such examples. Those are so difficult, not for the parent, but for the doctor, because I carry the onus of no survival versus survival, normal survival. And it's totally on my judgment call of echocardiography. And medicine is a lot of gray zone, huge white gray zone, and a very narrow white and black at the end. So falling in this gray zone, the doctor carries the burden of telling them, I don't think there's a problem and you should continue. And then you keep fear in your mind that every time you follow the patient up, will the patient start developing a problem or not? So it happens at both the extent. And actually, to tell you the truth, the most beautiful cases and memories I have is when you tell a parent who's come totally prepared to terminate the pregnancy, and then you tell them, I don't find a problem, and your baby is normal, you don't need to terminate. And the tears they have, you can never forget them. They're tears of joy which don't stop. They can't believe their life has changed so much.
Now, doctor, we are talking about many myths. Let's bust a few myths before, moving ahead in our discussion. That's number one. Parents often say, my child is active, so the heart must also be healthy. Is it true or false?
Oh, false. Heart is an organ which keeps working till it decides not to work. And then we don't exist. So, a disease can progress to a very large extent and still the child is fully functional, playing and running out. Because if it's slow, the body compensates it completely. Case in point, child comes pumping heart, we say the ejection fraction, a common number we look at, normal is 55. Child comes to me with an ejection fraction of 15% instead of 55 and is running, playing, doing everything because the body has totally compensated. So a well child and a well heart, not necessarily true.
Then heart defects are always hereditary?
Never. Almost never are they genetically transmitted in the family. Very rare to see that.
If a surgery is recommended for a newborn, it is safer to wait until the child grows older.
Surgery done earlier and body made normal earlier is better. The only precondition to that today, and medicine is that advanced, is a premature baby.
A hole in the heart always needs surgery?
Not necessary. A small hole does not require surgery if it's not causing symptoms and does not affect the heart in any significant way.
All right, so while we are busting a lot of myths, let's, end this segment with what's that one myth which should disappear starting tomorrow?
Oh yes, this is a no-brainer. And why did I take so long for it? Maybe I don't have that brain. But yes, the myth which should disappear tomorrow morning is that children who have heart surgery done are not going to be normal. They are normal children. Majority of them are not. 95% of them are not handicapped physically, mentally. In fact, we have children who have undergone heart surgery, have become doctors, computer engineers, IBM, you name it, Google, everywhere they're working, all over the world, doing everything. They are completely normal. In fact, even many of them have become mothers themselves.
All right, now let's move on to other segment and start with that, how different is treating a newborn's heart compared to treating an adult's heart?
Newborn heart is an amazing heart. It's amazing because it has so much strength. You can literally do everything to it and it bounces back within hours to complete normalcy. So much so that when a major heart surgery is done in the newborn, within hours, the heart is functioning normally, but the whole body takes a hit because the other organs are slow to come back. Slow, so 24, 48 hours, the other organs will take time to get back, but heart is completely fine, ejecting at 55, 65%, right minutes after heart surgery. So the newborn heart is extremely resilient, extremely strong, and recovers much faster than an adult heart or even an older child's heart for that matter. To give you an example, I recently did an angioplasty on an 1100 gram, and this is not the first 1100 gram baby I've done. So I recently did it, 1100 gram baby, and we put a stent in the main artery called aorta. And next day, the baby is off the ventilator and by evening is feeding. 1100 gram baby. And I said, hey, this kid is too advanced for me.
So what's the smallest baby you've ever worked on?
About 1000 grams. We've done one 800 grams, but that was a very difficult case. So 800 grams, we did the intervention, the baby survived for a few days. but I'd like to count the babies who've survived long.
Before moving on to the other questions, because you said that, in a lot of cases, in few cases, babies do not survive as well. What goes inside your mind at that time?
So this is a deep insight and, very incisive question. The first feeling is a feeling of guilt. The first feeling is a feeling of guilt. In fact, there's a movie, a documentary, which won an international award of documentaries, I think an Oscar on documentaries. It was on Chernobyl children, where a surgeon from US goes every year to Chernobyl, where they have a huge number of children with heart disease, and he treats them free of cost. And they have a scene which is, for a cardiologist, it really shatters you. He hides in the stairwell and starts crying. So that's where you are. You're sitting on a chair where you can't express your emotions, and it bottles up inside you over years and decades, and you cannot push it aside. You cannot push it aside.
And
You
how do
carry that
deal
burden.
with that?
How do we deal with that? We have to have our hobbies, our interests. We have to have mind diversion. There is no way you can get away from a child's death. You never forget a mother who's lost a child. Ever, ever forget. You cannot. So we have to look into the eyes of the mother who's lost a child to know the burden we carry for the next child.
While we talk about the, pediatric heart procedure, what does it take behind the scenes before this procedure actually begins?
So that starts about 3-4 days ahead. So we need the anesthesia team locked in to be aware of every comorbidity the child has. We need all the equipment that is needed to be available to us, because sometimes planning can be for a specific procedure. But if we have findings slightly to the left or right of that, we need other equipment. So we need a huge amount of, stents, balloons, covered stents, wires, catheters, to make sure that that one window we open into doing a procedure, it closes with a complete resolution of the problem, and we don't have to tell the parents, we found this, so we have to come back and do this.
So in that case, is there any medical innovation that excites you and could probably change the outcomes in the next few years?
Yes, definitely. So first of all, cardiology is one of the fastest advancing fields. And advancement in pediatric cardiology is not as fast, but is going to be majorly changing. So one of the biggest changes that has happened in the last 5 years is the replacement of the heart with a mechanical pump. This has already happened. The challenge today is not the pump. Heart, unlike the liver or the kidney, is not doing a metabolic function of chemicals, enzymes, catalysts, and making urine or making bile. It is just a pump which pumps blood forward. So this pump has already been replaced with a mechanical pump, which means we can go buy a pump and put it here and say heart replaced, no heart transplant needed. That is the implication of it. There is a problem to it. And the challenge is not, again, a mechanical pump problem. It is a battery problem. This heart needs a battery to operate. So you need wires coming out, and you need to recharge batteries. This is the only problem in replacing the heart completely.
But how will that happen? How will the wires going to come out and you're going to recharge?
So this happens. There are already a lot of people living with it. People have lived 10 years with this.
Is it not painful?
No, it is not painful. You just need to do a sterile dressing here and then recharge your battery. So this can be a temporizing procedure, that is a bridge to transplant, or it can be a solution itself. So we are very soon, in the next 5 years, going to reach a point where either we will have hearts which do not need a battery at all. They are called levitation valves. That means the pressures in the chambers will change to a point that the valves open themselves and therefore not require electricity. Or we would have batteries which can be implanted and you do not need a recharge. This is the advancement. Unlike liver, where we don't have a mechanical liver replacement available, or a kidney, we don't yet have a replacement kidney available, but we have external dialysis available. Heart is going to, in the near future, be a completely replaceable organ.
Really exciting times. Really looks like the model of how EVs recharge themselves, right? But again, for that industry also, the problem is battery.
Right, the battery has been solved. It needs a hydrogen battery. The certification for hydrogen battery for commercial use has not come yet.
That note, one question, like before this podcast, I've spoken to a few parents as well, just to know what they think. A lot of people are often hesitate to ask. A lot of them probably feel that why is pediatric heart treatment so expensive? Because it is expensive in a lot of places. So can you help us understand what goes into the cost?
The way heart surgery is done is the heart is stopped. An incision is given on the heart, it's opened, and a patch is put to close a hole, or a valve is opened up and a patch is put to widen a path or something, whatever that is done. When you stop a heart, the body can't stop getting oxygen, glucose in circulation. That function is done by a pump. So to take blood out of the body, put it into a mechanical pump which will function for a few hours and not get clots into it, will give oxygen instead of the lungs, will then pump it back into the body, and imagine, be a pump which will repeatedly do this day in and day out for the next patient and the next and the next. And there are hundreds and thousands of heart surgeries happening every day in India and get no complication for being on pump. The complication happening because you have, a brain clot also, or a brain atheroma also, or a leg clot or a leg atheroma. Those are different complications from the disease which caused the blockage in the heart itself, but not to have a complication of that pump. So the pump is expensive. The membrane is expensive. And it's all very subsidized in India. We say 3.5 lakhs is a lot for an Indian because our GDP is low. Okay, people are coming from all over the world to get this surgery done in India because it's the cheapest. The cost in US dollars for foreign patients in India is minimum $5,000. The cost in US is $50,000 to $100,000. The cost in UK is 50,000 pounds, period. In no other country is it cheaper than India. So we have to be realistic and utilize and start manufacturing these things in India so it gets cheaper. And we have to have the manufacturing things in healthcare go up to that level. But in the meantime, we need to allocate cost for this and we need to do this. So it is expensive for our GDP.
But then do you think that finances are, still the biggest reason that children do not receive the treatment at time, on time?
Absolutely. Unfortunately. This is where non-governmental organizations come in. There are in North India about 3 to 4 non-governmental organizations which are funding treatment of children with heart disease. And they are doing it, some are doing it selectively for simple procedures and have appropriately made hospitals where that can be done. Others are doing it on non-select patients so that even a newborn survives. And many do not want to pay or fund the surgery of newborns. This is a challenge in my field where newborn surgery has the best outcomes and the longest outcomes. And you don't want to lose a newborn who can have a completely normal life. So the struggle remains how to fund the unfunded patient. This is our biggest challenge in our field today.
Child Heart Foundation has come from this very motivation?
Yes, that's right. Child Heart Foundation was founded primarily because we wanted an organization which people would not question. The problem with NGOs, first question arises is what is their funding, how do they function, is it clean or not? So we wanted to build something which is pristine clean, is platinum certified, it's audited by various auditing organizations, professional organizations, and is given a clean chit. So people have started investing their CSR funds into it, and which is resulting in surgeries of 500 children per year in North India. We want to take this to 1,000 and 5,000. And for that matter, for every child who needs treatment. That's what Child Heart Foundation wants to do. It is actually founded by parents of children with heart disease. Unlike many NGOs which are founded by industrialists or people who can invest in it, there is no investment except well-being of future of children.
Dr. Kohli, it was really a fascinating conversation, and I still feel after an hour that we can still talk much more on this issue and also the things surrounded, right? The larger ecosystem probably. But I would like to, end the podcast with a few rapid fire questions, just so that our viewers also know what we have talked about in the entire discussion. In summary, you'll have to complete the sentence, right? The biggest mistake parents make is?
To presume that everything is okay with their child.
Okay, the most underrated part of child's health
is the food the child eats and the proteins he needs to take for growth, 2 grams per kg per day.
Okay. One habit every child need more of?
Sleep well at night, play enough during daytime, and eat only homemade food.
One habit every child needs less of?
Is to please understand, you need to read the labels. You need to teach your child to read the labels.
One thing schools also should change.
Schools have to get more health conscious, proactive, at least have an AED in every school. That's one of the agendas I carry personally, to even save 1 child a year if we can do that in a school. It is so tragic to lose a healthy looking child in school, and AEDs have been known to prevent sudden death outside hospitals. So every school in India should have an AED. At least schools who can afford should put it tomorrow. Why the hesitation to put it?
One thing every pediatrician should prioritize.
That heart disease, tell the parents when you suspect it, that majority of them can be treated and the child will do well. The outcomes of surgeries and interventions are 95 to 98% today.
One healthcare innovation you're most excited about?
I'm excited about trying to do more surgeries without doing surgery, but by intervention. So balloon angioplasty, stenting in smaller and smaller babies.
In the future of, pediatric cardiology, in one word, how do you see the future, or one sentence probably?
Every child in India should get the treatment they deserve.
All right, on that note, thank you so much, Dr. Kohli, for being a part of this discussion. Before ending it, like, if a young parent is watching this podcast today and takes away just one thought from our conversation, what would you want that thought to be?
Young adults are getting heart disease. That heart disease onset starts 15 or 12 years of age. So you need to be very aware as a parent what your child is eating. It is not sudden overnight that heart attack happens at 30 or 35 years of age. You need to start building food habits for your whole family from 5 years onwards. If you start at 15, you've lost 10 years already. So what goes into your child today will cause something at 30, 35. And you are responsible because you passively gave consent for it as a parent. Please stop giving passive consent for food which is so unhealthy for our children.
Start reading the labels. I think everything is available on the internet. If you type a word, you would get to know what problems it might cause. We also have AI now, at least to help us with reading the labels, and not more than that, because for anything much more than that, we do have a doctor. It's time we realize that also, and not an AI. Well, thank you so much, Dr. Kohli, for being
It's a
part
pleasure.
of this discussion. And to our viewers, stay tuned for many, many more such insightful conversations only at ET Health World.